to our monthly community forum. I first want to mention today's February 28th, but tomorrow we'll start Developmental Disabilities Awareness Month. The theme this year, we're here all year, influencing change, impacting lives. So there are a number of events that we will have to commemorate Developmental Disabilities Awareness Month, beginning on Tuesday, March the 4th, at the University of the District of Columbia from 4 to 6. At the Student Center, it's right there at the Van Ness Metro Station. A journey towards inclusivity, honoring the life and legacy of Judy Heumann. On Monday, March 10th, Quality Trust will hold their annual Better Together reception, which will be at Leah's Restaurant on Willard Avenue in Chevy Chase, just over the line from DC. On March 11th, there will be a disability awareness training encounter, a virtual session for employers. That's from 10 to 11:30. On Saturday, March 15th, Project Actions meeting will be in person at the First Trinity Lutheran Church at 501 4th Street Northwest. And on Thursday, March 27th, we will end out the month, as we always do, with a big event. We'll have Advocacy for Equity Awards ceremony here at DDS with all of our co-sponsors of that event, and that will be from 4 to 6 on Thursday, March the 27th. It was included in today's invitation, but I just want to remind people that on Monday, Department on Disability Services, the Office of Disability Rights, and the Mayor's Office of Deaf, Blind, and Hard of Hearing Services will have our performance hearing. That will be at the Wilson Building on Monday beginning at 9:30 a.m. The Office of Disability Rights will go first. There are also opportunities if it is more convenient for a person, you can also participate virtually. And the information for that, as I said, is included in our invitation for today. We have one presenter today from the Office of Disability Rights. Peter Steffen is going to talk to us about the Olmsted plan here in the district. However, before we get to that, I just want to talk briefly about the noise that all of us hear around us coming from the federal government and concerns that people have about how that might impact the district government and particularly Department of Disability Services, Medicaid. A few things. First, people may be aware that a representative in Congress and a senator, just one of each in each house, have introduced a bill that would end home rule in the District of Columbia. At our last cabinet meeting, the mayor commented just saying, this is an issue that arises periodically and always has throughout her career. She continues to have dialogue with, maintain relationships with, and speak with people on Capitol Hill. She has staff that are engaged in that process, as well as with staff at the White House. People may be aware she went down and met with the president-elect before inauguration, just to talk about the shared responsibilities, given that the District of Columbia is where the federal government resides, to talk about how we can work together. What she has emphasized for us in the district government is that we need to keep doing the good work of the district government so that people can recognize that this is, in fact, a well-functioning city, a city that has like one of the highest growth rates in population across the country, has a public school system that actually has had the highest increases in student performance. So we really are a city that is progressing and doing well. And thank you very much. We don't need additional support or other things from the federal. There are things we need from the federal government, much like other jurisdictions. We pay taxes. Historically, per capita, the district has paid more in federal taxes than other jurisdictions. And paying those taxes in, we expect to get support back. So one of those, people may be aware that in Congress right now, there are a couple of issues ongoing related to the budget. First is that it's been a number of years since Congress has actually settled on a budget. They have operated on what's called a continuing resolution. They just agree to continue the existing budget in place because they can't come to an agreement on the budget. They are negotiating on a continuing resolution, on a budget that would be a budget reconciliation bill between the House and the Senate. It would only require 51 senators to support it. So you don't have, on a budget reconciliation bill, there's not an opportunity for filibustering, so you don't have the 60 vote margin, which means that the Republicans on their own could pass a budget. Each chamber has now passed like preliminary budget instructions for their chamber. The House Budget Committee passed budget instructions that then go to each of the various committees to develop a budget. The Senate, the same thing. The recommendations from the House Budget Committee were very concerning. People may be aware the way that Medicaid works is that Medicaid is jointly funded by the federal government and the states. DC in this regard being considered a state. So it's a shared obligation. There's a federal match. The federal government pays a percentage of Medicaid expenses and the state or local government pays a percentage of the Medicaid expenses. There's a formula that determines how much the state's versus the federal obligation is. This formula requires that the federal government, based on how the formula plays out, pays between 50 and 83% of expenditures for Medicaid in a state. And it's based in part by the median income in the state. Since 1998, the District of Columbia, by statute, has a federal match that is established at 70%. All of the states have the formula, which is between 50 and 83%. Before DC's match was established at 70%, based on the formula, DC had to pay, the federal match was only 50%, which meant DC had to pay 50% of the cost of our Medicaid services. Since 1998, we've paid 30%. There are currently in the House a few different proposals that would have an impact on the federal match in Medicaid. Reportedly, the Speaker of the House said this week that he doesn't support any of the proposals that reduce the federal match. You can find that as reassuring as you find it. There are two proposals that could potentially impact the district. One of those is that they would eliminate the statutory provision that set the district at 70% and just require the district's match to be determined based on the formula in the same way that's determined in all the states. For DC, I will tell you this would have devastating impacts. Just to give you an example, in fiscal year 2024, the overall Medicaid expenditures for our IDD waiver were just under $340 million. Our local match in that instance was $100,682,000. If the match requirement had been 50%, you can do the math yourself, that would have required about an additional $65 million from the district. Or if you look at the 100 million, about 101 million that was budgeted for Medicaid waiver services for DDS in fiscal year 24, that would have covered, if the match were only 50%, a little over 200 million in services, which means that we would have to see a reduction of about $140 million in services, which is close to 40% of the 339 million in our program. Just so that people are aware, if we look at our residential services alone of residential habilitation, supported living, and host home in the waiver, they account for over 65%. So all the other services would, eliminating every other service except those, would still not get us to where we would need to be. If this kind of change were made, it would fundamentally change how we provide services. We would have to have some very difficult decisions about what this means in terms of service provision. It would clearly require a waiver amendment. And, you know, unfortunately, as people are certainly aware, the District of Columbia does not have more than just a delegate. We don't have a representative who can vote in the House or Senate. So those of you who may have family elsewhere, and any encouragement that can be given to, or advocacy that can be done about not resolving the federal budget issues on the backs of people who receive Medicaid would be helpful. So we don't know. I think anyone who listened to Deputy Mayor Turnage's testimony this week would have walked away feeling quite discouraged. We don't know in the end how this is going to play out. What we do know, in addition to how devastating this would be, what we also know is even before we had to confront the possibility that Congress would fundamentally change the relationship between states and the federal government and how Medicaid is funded, we were already confronting the reality that in fiscal year 26, we're looking at being fully beyond ARPA, so the American Rescue Plan Act's assistance, which in part means incorporating into our local budget the enhancement required in order to meet the costs of our DSP wage increase. So we had a challenging fiscal year 26 budget. We talked in our community forum, I think it was in September, we talked about how challenging fiscal year 26 is going to be. With this other issue on top of that, we are really talking, I mean, if anything like that were to come to pass, as I say, it would mean fundamentally changing how we provide services. We would, of course, be working with providers in the community to have discussions about what our service system would then look like. As I know anything, I will inform people. So that's quite something to follow, Peter. So now, Peter Steffen with the Office of Disability Rights will talk to us about our Olmsted plan. And if there are any questions, please put them in the chat. I'm sure we'll have time at the end because we only do have the one presenter today.
Thank you, Director Reese. And that's really helpful discussion to have to frame this presentation because our Olmsted plan was revised over the past year before any of these changes from the current federal administration occurred or are being floated in Congress. And so with that caveat, I just want to make people aware that, we will continue to push for these goals under the Olmsted Plan as it's written, but kind of to begin where I'm going to end, this is a living document. And so as things change, this plan will be revised. That's why we update it periodically every 3 or so years. So just to start from the beginning, my name is Peter Steffen. I'm the attorney advisor for the Office of Disability Rights. We are the district's, next slide, please. So we are the district's office for basically advancing and ensuring protections under the ADA and related disability rights laws for people with disabilities as they relate to employment, community living, housing, transportation, and other government programs and services. So to that end, our office does a number of things. We offer information and referrals to district agencies and district employees and members of the public. We provide trainings and presentations like this one, both to district agencies, our grantees, as well as members of the public. We oversee and coordinate the district's compliance with the ADA, as I mentioned, and other related disability rights laws. And then we work with agencies' ADA coordinators. And then we also coordinate Olmsted planning. And so on the next slide, let me just explain a little bit more about what is Olmsted. It's the short name of a case decision from the U.S. Supreme Court, Olmsted v. LC, from 1999. The LC stands for Lois Curtis, one of two women who brought the suit, who were being unnecessarily kept in a facility because the state of Georgia did not offer mental health services that she or others needed to live in the community. So they were stuck in a psychiatric facility. She challenged that, arguing the state should offer her those same services in the community. The Supreme Court agreed and said Title II of the ADA prohibits the unnecessary segregation of individuals with disabilities. Okay, so to comply with the ADA's integration mandate, right? That's what has been interpreted by this decision. The Supreme Court has said, and DOJ has agreed with guidance that, the district, all the states and the district have to administer services and programs and activities in the most integrated setting appropriate to the needs of individuals with disabilities. So the most integrated setting that's appropriate is usually the community. Okay, next slide, please. Right. So the district's Olmsted plan establishes a vision for community living in the district. The district has had several previous Olmsted plans, and it's, like I said, updated every few years to help better coordinate services across different agencies and achieve a common vision for community inclusion. And based on the vision, the new plan, the 2025 to 2027 District Olmsted Plan, has specific goals to expand community supports and integration to help place people in with disabilities in less restrictive settings. And those are focusing on four areas: employment, housing, health and wellness, and transportation, which is the new priority added to this plan. Um, Next slide, please. So what is an Olmsted plan, right? It reflects a baseline, meaning it's what the district government is currently doing to provide services across the agencies right now. It also contains or should contain goals, and those are concrete and reliable commitments to expanding opportunities and supports. It also has and should have ways to measure progress towards those goals with specific and reasonable timeframes and benchmarks by which the district government can measure how much we're progressing. And the plan has to do more than just provide vague assurance of future integrated options or how we've increased funding generally. Okay, next slide, please. So the process we used to develop our current plan was a collaborative effort. It was the result of partnerships with district residents with disabilities, their families, members, and including at this forum, DDS Provider Forum, among many others, the community, rights organizations, and disability rights advocates, as well as 24 partner agencies. So this plan reflects specifically the discussions and feedback we also gathered from 3 town halls throughout last year, conversations with, like I said, stakeholders and the 24 partner agencies to identify goals, public comment, 2 different public comment periods, an agreement with the agencies who are undertaking the different programs and efforts about the strategies and the metrics and realistic benchmarks. Um, and then also just we used a lot of the data that was already available from the agencies since our last plan through various public methods. So on the next 4 slides, I want to highlight additions in each of the priority areas of the Olmsted plan that I think show the district is not only doing a lot to support people with disabilities in the community, but also working on expanding community access. So these are just a few of the many programs and goals in this plan. If you want to review the entire 56-page plan, it's available on our website. And so, yes, perfect. So this slide just highlights a few of the housing goals that have been added. So just to kind of give context, the housing priority is focused on ensuring that district residents with disabilities live in the communities of their choosing and that district residents transition into community-based housing to meet their needs. So one of those new additions is DHS, which operates many emergency service systems for housing for people, now has added a safe shelter at a recently purchased E Street property to provide non-congregate shelter. So what we mean by that is this will allow individuals who are medically vulnerable or individuals who can't be served in a low barrier shelter, a normal shelter, because they have an adult family member of a different gender, or they can't seek or not able to seek congregate care. So they have a place to go. This builds on a lot of the lessons that the district learned during the pandemic for housing individuals who experience homelessness. The other program on here is the Safe at Home program and expansion. So just to back up, give a little context for those of you who don't know, the Department of Aging and Community Living operates the Safe at Home program. It provides in-home modifications to anyone's home if they own it or rental with permission from the landlord. It's open to anyone with an income threshold. I think it's 100% of the area median income. And adaptations include, but are not limited to installing like handrails, grab bars, bathtub or shower cuts, shower chairs, stair lifts, accessible lighting. And DACL is committed to expanding the program to now provide kitchen adaptations as well. In just as evidence of the program, actually, the efficacy of the program, An American university survey showed that almost 80% of participants um, were able to stay in their home once those modifications were completed and did not experience a fall. And it's cost effective, right? The average cost for a Save at Home program modification is about 4,000 per client, which is significantly less than the average cost of a hospital visit for a fall or other problem. So the last one on this slide is just the addition of this Medicaid state plan housing supportive services. So for beneficiaries, Medicaid beneficiaries who are or at risk of homelessness, DHCF and DHS offers this service to help find and maintain permanent housing in the community. It's started a few years ago, and it consists of housing navigation services and also stabilization, so that people who find a housing in the community can stay there using Medicaid funding. Okay, next slide. So the next priority, health and wellness, right, or healthcare. The vision is that district residents are supported in when they transition, right, out of institutions and into community-based settings, so that there's a seamless transition there and they have the supports they need. The second part is to ensure the quality of the supports in the community, so that people can remain there, right, and not be at risk of institutionalization. So the first bullet here is just focused on increasing provider capacity. That is a familiar topic to anyone on this call. Obviously, we have a variety of waivers, the EPD waiver, the IDD and IFS waivers provided by DDS or operated by DDS. And as we know, right, delays and gaps in the delivery of supports, long-term care supports, can occur. They're often due to workforce challenges or staff turnover, sometimes communication issues, but in addition, even when staff can be hired, it's often an issue retaining them. So the metrics in the Olmsted plan seek to quantify those challenges to help the agencies start to address them. And as Director Reese noted, the addition of ARPA funding has gone some ways to helping retain those staff members. The second bullet point is just increasing the quality of these supports. And so the Olmsted plan seeks to measure that in the first place, and then from that improve that the quality by measuring, for instance, how quickly any incidents are investigated, excuse me, and then how quickly they're resolved. It also focuses on improving the number of providers who comply with the audits, reviews of practices, and all of that stuff on the back end. So next slide, please. So the third priority is employment. And the guiding principle for the employment priority is to increase the access that people with disabilities have to integrated and competitive supported employment, right? And not just any, but person-centered, right? We want informed choice to meet the individual's preferences, interests, needs, and strengths. So this employment opportunities should be the first option explored for transition age youth through DC's publicly funded services. And the district government itself has committed to becoming a model employer for people with disabilities. So just to a few bullet points from the plan. One, increasing classroom inclusion for students with disabilities is incredibly important because skill gaps can start early. In FY21, that's a few years ago, but only 76% of students aged 16 plus in DCPS schools had appropriate measurable post-secondary goals. It should be 100%. And while most DC students spend their time in general education settings, 9% are served in a separate school or a segregated classroom, which is much higher than the national average. So one of our strategies in the plan is to improve classroom inclusion for students with disabilities. And we're monitoring the percentage who learn in a separate segregated environment. And then the other bullet point here is improving the seamless transition to post-secondary life. And the third is increasing the hiring, retention, and promotion of people with disabilities. So on these points, I just want to highlight that, nationally, statistically, people with disabilities face higher levels of unemployment than people without disabilities. And only 35% of district residents with disabilities are employed, 35%, compared with 78% of people without disabilities. Um, so the focus here is on not only enhancing the seamless transition, right, so that people aren't left in the gap after they exit school. They are able to connect with services like DCRSA and other services that can help them find and get a job or move to the next phase of their life, right? If they want to go to college or what have you. Next slide, please. The final priority in the plan and the new one is transportation. And the vision for this priority is that district residents with disabilities have access to the services, programs, and activities from the district by ensuring that we have a fully accessible public right of way, right? It's hard to get out and do things or take advantage of services that are offered if you can't even get out of the front door of your house. So that is a major priority for our transportation focus. And then the other is ensuring that we have timely, efficient, and accessible public transportation. Um, Such transportation obviously is critical for people living in the community um, rather than in facilities. So to enable that, right, we want to ensure both of those things. To just focus on a few of the things in that section. Number one, the first bullet point is accessible sidewalks. Accessible sidewalks are critical, like I said, for ensuring people can get out of their own homes and connected to and included in the community. All too often, the physical and operational barriers impair employment opportunities and even healthcare outcomes, right? If you can't get to your doctor's office, you may miss an appointment there. So it really affects every area of your life. So that's why sidewalk accessibility, sidewalk repairs are one of the most critical efforts in the plan. Um, so that's why the emphasis is there. And also to measure that with the data we have, with what we have now, what progress we're making. So DDOT just released their ADA transition plan for FY25. It shows some progress, which is encouraging, but there needs to be more, right? Which is why these are included in the plan. DDOT's PAVE DC program consistently plans to address sidewalk repairs, and they have a dashboard online where you can go and look at the progress that DDOT is making on that. Um, so with that, then the other piece, let me make sure. Right. So in the Olmsted plan, the way we're measuring sidewalk accessibility is by first looking at where sidewalk gaps exist. DDOT is looking at that already and is working to address those gaps throughout DC. Wherever there's a residential street, if there's a gap there, DDOT has surveyed those and is planning to address them. There's a different dashboard that also shows all of those efforts. There's also in the Olmsted plan metrics to measure the number of miles of sidewalk repairs made each year, the number of curb ramps that are made accessible or curbs in case there's no curb ramp, and the number of automated pedestrian signal devices installed. Those are the devices at corners that have the button and beep so that people with low vision or who are blind know when it's safe to cross. Um, and that's not the only issue with sidewalk accessibility. In 2023 alone, DDOT received over 2,000 complaints about dockless scooters. They're not the only operational barrier to sidewalks, but we are measuring that with the number of days it takes to address complaints about dockless vehicles in 311. And then another issue with sidewalk accessibility is snow removal and making sure that that happens, not only for sidewalks, which are primarily the responsibility of the owners of the houses or buildings that they are next to. Serve DC, though, which is the mayor's volunteer agency, provides volunteers to shovel sidewalks for people with disabilities and seniors. So that's a great resource. DPW handles snow removal for the streets, but previously, no agency handled snow removal on curb ramps. But I'm glad that HCMA has worked with DPW and Serve DC to have a partnership where ServDC will work on clearing curb ramps as well when requested. And then the other bullet on this slide, I just want to mention bus stops are incredibly important for transportation. DDOT is consistently working on ADA compliance at bus stops across the district. DDOT coordinates with WMATA, right? Because WMATA runs the buses, DDOT manages the bus stops. So whenever WMATA realigns their stops or their bus service, DDOT works with them to try to find a location that's accessible. Also, they are made of stops that are not moved can be made accessible through ongoing DDOT projects. And so there's a series of projects that are in place. DDOT makes a certain number of renovations happen every year for bus stops. There are over 3,000 bus stops in the district, and DDOT has a franchise agreement with Clear Channel that allows them to build up to 788 shelters at accessible bus stops. This number is fluid due to changes and other developments, but a couple years ago, the bus shelter inventory showed about 760 bus shelters at stops across the district. And my understanding is DDOT has recently renegotiated that to expand that number so that more bus shelters can be built, which benefits a number of people with disabilities, not only people who may need to sit, right, because they can't stand for a long period of time, but also people in motorized wheelchairs or scooters who can't have their equipment getting wet, right, if they're waiting for the bus in the rain or snow. So the Olmsted Plan tracks the bus stops that are made accessible, and that's helpful for tracking that progress. Okay, next slide. So how can you help? I threw this in there because I know a number of people in this forum on the call are advocates, and we really value your all's contribution both in the development of the Olmsted Plan and across the board. So I just want to highlight, right? You can help district agencies understand when and where there are problems. Of course, the district does not know everything. We don't have eyes everywhere. We need your help reporting anything that you find as a barrier or a problem. And 311 requests are one way to do that for some problems, but it doesn't always go to the right people. For example, DDOT's own ADA transition plan states that their ADA coordinator is not made aware of 311 complaints. So it's really helpful to also report the issue to the agency's ADA coordinator. If you don't know who that is, or you don't know which agency to go to, ODR, my office, the Office of Disability Rights, has we will handle any complaints related to disability rights. And we also maintain a list on our website of ADA coordinators that is constantly updated. So I just want to say that you can also advocate on these issues, right? You may not see instant results when reporting them, but reports create a record. That helps us track them and respond to them. And it's also useful for advocacy on these issues, whether that's with the agencies or with the DC Council. Um, and then I just want to say also, your input's always welcome for revisions to our Olmsted Plan, because like I said at the beginning, it's a living document. So at least once every 3 years, ODR revises the plan. So if you take a moment to review it and you have thoughts or feedback, please let us know how we can improve the plan. And next slide, please. So if you have any questions, please don't hesitate to contact me. My information is on the slide. I can put it in the chat. That is all I have at the moment. And I can turn it back over to Director Reese unless we have questions in the chat.
I don't see any questions so far, Peter. Thank you. So if there are any questions for Peter about the Olmsted Plan, thank you very much. That was a really helpful overview. If there are any questions, please let us know. You can type them in the chat, or you can also unmute yourself and ask. Or if there are any questions about the brief presentation I did at the beginning, I also, just related to our current circumstances here in the district, want to remind people, Mayor Bowser, in developing her budget, and she's done this since she was first elected back in 2014, she starts the budget formulation process by reaching out to the community to hear what the community's priorities are. And I think it's very important that we show up and make sure that she's aware, reminded that we're here, that what the needs are of the community of people with disabilities in the district, and the support that we appreciate that we get to date and need in our FY26 budget. And the last budget forum this year will be occurring tomorrow from 11:30 until 2. And it will be at the Kennedy Recreation Center at 1401 7th Street Northwest. So anyone that can attend, I think that it is always helpful to just make sure, as I said, to remind people that we are here. What's the, we're here all year, is that the theme for DD Awareness Month? It's the first day of DD Awareness Month, so showing up on the first day to remind the mayor we are here now and we will be here all year. I hope to see some people tomorrow. If there are no, I see there's 2 things in the chat. I'll just see if those were questions. Thank you, Peter. And Peter's contact information is what we have in the chat. If there are no other questions or comments or things that people wish to share, then I will just say, have a great weekend, everyone. As I said, there's a budget forum tomorrow with the mayor. And on Monday, we have our performance hearing, and I look forward to seeing people at that as well. So have a great weekend, and we will talk again next month. Thank you.